Good afternoon, everyone. My name is Gwendolyn Mahon, and I am the provost here at the University of New England. We are so glad you could join us to celebrate this momentous occasion at UNE. Today's event will feature some brief remarks to put the ceremonial groundbreaking in perspective. Then we will pose for some photos with shovels, of course. And finally, we'll enjoy a reception where it's a little bit warmer than out here. At this time, it is my distinct pleasure to introduce our first speaker, UNE President James Herbert, who has been a fervent champion of UNE's health professions programs, including the College of Osteopathic Medicine, since his arrival to UNE in 2017. And he has been the leading force behind the college's move to Portland. James.
Thank you so much for that lovely introduction, Gwen. And I don't know what you mean, though, about it being warmer. If this feels great to me, any warmer than this, I start sweating. So I think it's a beautiful day today. So we tailor-made this weather for this occasion. So thank you again. And I'm so grateful that all of you could join us here today for this historic day in the life of UNE and the life of our College of Osteopathic Medicine. I'm especially pleased that we're joined here today by the Alfond Foundation Board Chair, my friend Greg Powell, by Hasley Frank, who is here on behalf of Senator Susan Collins, by Gail Keyser, who's here on behalf of Senator King, Sarah Lawrence, who's here on behalf of Congresswoman Shelley Pingree, Catherine Drummond, who is here on behalf of Congressman Jared Golden, and the Portland City Manager, Danielle West. Portland Mayor Kate Snyder sends her regrets. She was planning on being here but came down with a cold. So I'm also pleased that we're welcoming many members of Maine's distinguished business community, members of UNE's Board of Trustees, headed up by our own chair, Dan McCormick, and also UNE's senior leadership team, as well as many students and professional staff and faculty, not only from the College of Osteopathic Medicine, but from other colleges as well. So thank you all for being here, and thank you especially to our student leaders from the medical school for being here. I really appreciate to see you. So we're all eager to get the shovels in the ground and to officially get this project underway, so I'm going to keep my remarks brief. As you might imagine, moving a medical college from one location to another is no small undertaking. And as we take a giant step towards doing just that here today, it's fitting to reflect on the amazing opportunity that this relocation presents and how it came to pass. So my vision for this project began to form shortly after my arrival to UNE. I saw a chance to position Maine's only medical college amid the hub of Maine's growing healthcare and bioscience community here in Portland. It was clear to me that moving UNE's medical school to Portland would generate a wealth of new opportunities for our students. It would facilitate increased integration between our budding physicians and the aspiring healthcare professionals and our other programs on UNE's Portland campus. Although I saw early on how valuable such a move would be, having a vision does not make a project of this scale come to reality, not even close. At that early stage of contemplation, I suspected my idea would be met with some initial skepticism. After all, our College of Osteopathic Medicine had been in Biddeford since the 1970s when it was founded, and I was keenly aware that we would be upending nearly a half century of tradition. Then again, UNE is known for having reinvented itself regularly through the generations and for adjusting more nimbly than many other institutions to the ever-evolving challenges and emerging opportunities in higher education. So maybe there wouldn't be quite as much resistance as there might be at other institutions. So among my first partners was the Dean of the College of Osteopathic Medicine, Jane Carrero. It was so important in that initial stage to have buy-in from Jane, and then soon after from the rest of our dedicated medical school leadership team, as well as so many of the faculty and eventually students and alumni as the word of our audacious plans spread. UNE's Vice President for Operations, Al Tebow, was another vital partner early in the process and continuing throughout our plan's development. But we needed more than a growing consensus that our medical school belonged in Portland. We needed the type of institutional support that no less a Maine institution than the Harold Alfond Foundation could provide. I am so grateful for my friend Greg Powell and his colleagues at the Harold Alfond Foundation for working with us to secure the leadership gift we needed to realize this vision. When we announced the $30 million commitment from the Alfond Foundation on October 6, 2020, it marked the largest gift in UNE's history, and it allowed us to take a giant step forward in making this vision a reality. The funding not only supports the construction of the Harold and Bibby Alfond Center for Health Sciences that we'll break ground on in just a few minutes, but it also will allow us to redouble our unique programming in collaborative, team-based, interprofessional education and science on this campus. It will create an integrated health sciences campus that will be unique in all of New England in the concentration of diverse healthcare programs co-located on a single footprint. In addition, it will allow us to grow our existing programs and to develop new ones on the Biddeford campus in order to meet critical workforce needs in Maine and in the region. Another vital external partner along the way was Maine's senior senator, Susan Collins. Senator Collins helped us secure a $5 million federal appropriation towards this project. Although her busy schedule precluded her being here today, I hope Senator Collins knows just how appreciative we are for that support. A number of other loyal UNE constituents, alumni, friends, parents, employees, have all stepped forward to put their names and their generosity behind this project as well. We're eternally grateful for all of you for your help. As a result, we're able to construct a building that will allow us to admit and train more medical students each year with state-of-the-art learning spaces where those students will get hands-on clinical experiences and have the opportunity to learn alongside their peers in other health profession programs. When it's completed, this project will be transformative for UNE, and it will be transformative for the study and practice of medicine, and indeed for healthcare more broadly in the state of Maine. I'm so happy you all could join us to break ground on the Harold and Bibby Alfond Foundation for Health Sciences. And I look forward to seeing you again for a ribbon cutting ceremony when the project is completed in just a few months. So hope Al Tebow heard that, because as soon as we're done, I want you out there with that backhoe digging. So we don't mess around. At this time, I would like to invite to the podium my friend Greg Powell, the chairman of the board of the Harold Alfond Foundation, to say a few words. Greg?
Terrific to be with you all. I just wonder a little bit about the weather. I had a 5-hour speech prepared, but I decided, even though James thinks it's warm, all right, that we might cut it down by a few hours. So anyway, good afternoon, everybody, and thank you for your kind words, James. It is a pleasure to be here this afternoon with my colleague from the foundation, Allison Holton, and to begin what I'd say is yet another great chapter in the extraordinarily important work of this growing university. Let me just say on behalf of the foundation and the Alfond family that we are deeply grateful and proud to know that the new Health Science Center will bear the names of Mr. and Mrs. Alfond. Thank you for this honor. And a huge thanks to all of you here today and beyond who have made the launch of this construction project possible. With the superb leadership of your president, provost, dean, board, faculty, and staff, you're all a winning team, And Harold Alfond loved nothing more than a winning team. So, as you've heard, the Alfond Foundation has been a supporter of UNE for over a quarter of a century. With each grant, we were inspired by the university's healthcare mission, the relevance and the importance of that mission, its vision of quality health care for Maine, and the dedication to achieving both by UNE's leadership. In Biddeford and here on this campus, the people of this university have dedicated themselves day in and day out to providing high quality, job relevant education. Education that deliberately and creatively prepares students to meet the healthcare and workforce needs of our state. So here at this groundbreaking, let me add just a few more words to what James has said as to why we at the Foundation are more inspired than ever to support UNE in the construction of the center, which will soon grace this beautiful campus. First, access to quality healthcare has never been more important than it is today. And there's nothing like a worldwide pandemic to make that case. And with that said, educating and producing highly skilled healthcare professionals, more of them, is more important than ever. In countless ways, this project builds upon UNE's legacy of service to our state as the premier educator of Maine's healthcare workforce. Let me say that the second reason we are so inspired and excited to support this project is that it is the new home for UNE's medical school, and as that, this center will enable the university to educate more physicians so desperately needed throughout our state. Third, we are particularly proud that the center will become the home of UNE's nationally recognized model for interprofessional healthcare education, or, as Mr. Alfond would put it more simply, teamwork. Fourth, the specific benefits of this educational model are numerous, but in the end, UNE's education model and research shows that when health professionals work together as a team across disciplines, they can be more efficient and provide better patient outcomes. Such teamwork is especially impactful and important here in Maine and beyond, where healthcare professionals are few, access to healthcare is constrained, and the need for healthcare is so important to the quality of life. Fifth, and finally, let me close with a bit of history. A history I love to share, and some of you may have heard me talk about before. It's about the very beginning of the Foundation's reasons for supporting this university and why we continue our support today. It's about gratitude. Nearly a century ago, early in his career as a young man, starting his first shoe business in Norridgewock, Maine, Harold Alfond fell seriously ill. Back then, as today, Maine grappled with a shortage of healthcare workers statewide and especially within rural communities. And back then, as today, Norridgewock was quite a rural place. Harold was a lucky man. He was lucky because there was one family doctor in Norridgewock, Dr. Joseph Eshelman. Dr. Eshelman was an osteopathic physician, and as Harold gratefully recalled, Dr. Eshelman pulled me through. From that time forward, Harold lived a wonderful life. He found the love of his life, Bibby, fathered fine children, 4 of them, taught them to give, founded Dexter Shoe, launched the first charitable foundation in Maine, and on and on. Healthcare gave Harold his life like it has and does for all of us. Harold never forgot Dr. Eshelman, and the gratitude he felt for Dr. Eshelman highlighted for Harold the importance of UNE, its mission, the students, and its graduates. And that gratitude is with us today as we prepare to put the ceremonial shovel in the ground for the new center, although looking out there, I don't know that much more shoveling will do it any more than they've already done. So anyway, in conclusion, we're hugely grateful to this university and the healthcare professionals it has produced in the past and will in the future. You pull us through in good times and bad, And congratulations, good luck, and thank you.
At this time, I got to move that down. At this time, I would like to invite Dr. Jane Carrero to speak. Dr. Carrero is UNE's Vice President for Health Affairs and the Dean of our College of Osteopathic Medicine. Jane.
Thank you. I am incredibly humbled to be here today to represent the College of Osteopathic Medicine. And thank you to the community for supporting us. Thank you specifically to President Herbert and to Mr. Powell for the faith that you've shown in our osteopathic medical school and the investment in time and resources that you've both devoted to it and to this project. As you heard from Mr. Powell, ours is the only medical school in Maine and the only osteopathic medical school in New England. And we're the #1 provider of physicians for Maine, and we're very, very proud of that. We reflect on that fact that we have a special responsibility to Maine and its community. The people of Maine depend upon us to educate their future caregivers with the knowledge and skill to provide excellent quality of care that they deserve. We're proud to deliver on that promise. Our medical school graduates rank in the top 10 nationally for the scores on the comprehensive medical licensing exam on all levels, and more than 60% of them wind up practicing in primary care, where their expertise is desperately needed. If you've recently moved to Maine or have needed a new primary care physician recently, you've probably noticed that there's a significant shortage of physicians in our state, especially in primary care, and especially in the outermost reaches of our rural state. At the same time, our rapidly aging population makes access to physicians all the more critical for our state's people. In response, we've steadily grown our COM class sizes. We grew from 116 students per class to 165 in 2014, and we're going to expand further to 200 students when we move to this new facility in Portland. The students that are standing behind me here, joining us, represent our future. They have passion, dedication, intelligence, and skill. The new facility that we are building for them and for the students who will follow will take the world-class preparation Unicom now provides to previously unimagined levels. It will also allow our COM students to train in collaboration with UNE's many other health profession programs, which are currently located on this campus, and will allow better connection to the many hospitals and healthcare professionals in our region. This is a special day for UNE, it's a special day for COM, and it's a special day for the study of medicine in Maine. Thank you for all joining us to commemorate it.
Thank you again to everyone for joining us. At this time, we are going to put the shovel in the dirt. And so I'd like to invite James Herbert, Greg Powell, myself, and Jane Carrero over to the pile of dirt over here. We're going to take some formal photos, and then we'd like to invite anyone else who'd like to take a photo to come up after that. Thank you.
Okay, let's do it.
Okay.